name's Christina. I'm gonna be your nurse today. I just have a few things I need to do with you today. Can you give me your name and date of birth? Perfect. All right, Minnie, so today we're gonna be giving you some medications through an IV that the doctor ordered, and I'm gonna be getting a blood sample. So first I would check my patient's vitals, check the MAR, make sure she doesn't have any allergies to morphine or medications of its class, and then we're gonna get started, okay? I would help my patient sit up so I could get her in a comfortable position, and we'll pretend I did that. Okay, so I would wash my hands at the sink, 20 seconds, come over to the patient with all my stuff ready, and I will put on my gloves. So first I'm gonna start with the blood draw. Just gonna check which vein I wanna use. Okay, so I'm gonna apply my tourniquet. Hold on, let me set up my needle first. Okay, now I'm gonna apply my tourniquet. It's gonna be tight for a little bit. Make sure my bevel is up. I would let that dry, but we're just gonna go ahead, it's a big old needle. Go ahead and perfect. Take that out. I get my gauze and apply pressure. Dispose of this in my sharps container. All right. I'm gonna confirm my patient's name and date of birth, put the date, time, and initial, and then send this down to lab ASAP. All right, now usually this wouldn't be all together, but for the sake of this video, we're gonna start the IV. All right, Minnie, so I'm gonna get your IV started. I'm gonna place it, and once I place it, we're gonna draw up the medication, which is morphine. Okay, get my needle started. Alright, so once again, I'm going to assess the veins. Apply my tourniquet. Clean it. And it is cross, up and down, circular. Okay. Oh my gosh. Pull my needle. Bevel up. Oh. Hold on. Before we start that, I should probably prime my extension tubing. So we would clean that. Port. And then just prime it. And as I'm applying pressure, I would, close that. Okay, Sorry about that, Minnie. Now we're gonna start over with that IV. Apply the tourniquet. Clean the site already. Now we would and then advance the catheter and pull a needle. And there we go. Now, we're just gonna flush, pull back, make sure we have blood. And then flush the rest of that. Okay, it looks good. Clamp that off. And we're just gonna put that Tegaderm on there. And we just put that right over the hub. And then we will initial and date and put the size of the gauge of the needle. All right, Minnie, sorry that took so long. We're gonna be giving you that morphine now. So for morphine, I wanna check my patient's respirations, make sure that they're not in any kind of respiratory distress, because that medication can cause some respiratory issues. We're going to make sure she's not allergic to the medication. And then today we're going to be administering 2 milligrams of morphine, and our medication is 1 milligram per ml, so we're going to draw up 2 mLs. Touch my needle. Dispose of that in the sharps. With my filter needle, I'm going to draw up the 2 mLs. Okay. 2 mLs. Recap it. I dispose of that needle in my sharps. Now I would clean the hub 20 seconds, or the port 20 seconds with some alcohol, making sure that I am administering 2 mLs. And this medication has to be administered at 2 milligrams per minute, so it'll be 2 minutes. Go ahead and open them. Get my clock, make sure I'm running it at the right speed. And the reason we don't want to give this medication any faster is because it could cause the patient to pass out. coming up on 2 minutes. All right, how are you doing, Minnie? All right, I'm gonna take that off, dispose of that. Just gonna flush your IV, okay? Make sure you get all that morphine in. Now, usually we would also give the flush at the same rate, but for the sakes of this video, we're saying I'm flushing at the same rate, but all right, dispose of that. All right, Minnie, so I would secure this tail right there. Give the patient education about what to expect with the morphine. Make sure she's not getting up by herself. And that's it for the morphine. And then usually you wouldn't DC a IV that fast, but we're gonna be DCing it for the purposes of the video. All right, Minnie, so I'm just going to take your IV out now. So we take off the little tail. And then we wanna start going inwards. Nice and steady. All right, now that I'm getting closer, make sure I just gonna get my gauze, and once I pull that out, check to make sure the tip is intact while I'm applying pressure. Continue applying pressure till the patient stops bleeding. And I would add tape if I can get the tape off my fingers. All right. Now I'm just gonna check on my patient. How are you doing, Minnie? Are you doing okay? Might experience some bruising because of that IV, but it shouldn't be very much. If you have any questions or if you need anything, go ahead and give me a call. I'll be back to check on you, make sure everything's going smoothly. And that's it.